People are living longer. According to the CDC, life expectancy in the U.S. today is at an all-time high. This is largely due in part to an increased awareness of health status and access to information we never had in the past. But the longer we live, the more likely we are to face certain health issues. So when a diagnosis of cancer surfaces, medical professionals today are at an advantage. For at their disposal is an arsenal of treatment options helping to increase our longevity and quality of life.
I as a medical oncologist, particularly have a new armamentarium of all kinds of different drugs and drug classes, far beyond the good old chemotherapy. We have targeted agents, biological drugs, drugs which interfere with hormones, and supportive medications which can make a total difference how even old drugs are being tolerated and perceived by the patient. Now, other things have changed is, of course, in other parts of oncology. Radiation therapies have changed. They have techniques which they use now together with other people. We use radiation in the operating room, we use radiation in combination with chemotherapy, and that's really new. And it leads to much better tumor kill and much more focused tumor treatment and less toxicity.
Without a doubt, today's cancer treatment strategies are helping millions. But when cancer spreads to the bone, particularly the spine, it can be especially devastating in terms of pain and neurological deficits. Occasionally, a more aggressive approach is undertaken, with the goals being relief of intractable pain and prevention of neurological disasters such as paraplegia or quadriplegia. The approach is cutting edge, reserved only for the most experienced medical professionals in cancer care. It is aggressive, it is misunderstood, but it is improving the lives of many patients with cancer of the spine.
With the new advances and the less invasive surgery, the risks, while they still may be high, higher than doing surgery for arthritis, a degenerative condition of the spine, while the cancer patient risks may be higher, the question that we ask ourselves and the discussion we have with the patient is that risk higher than not intervening surgically? And what we want to avoid are the problems that we could potentially fix with surgery before it may be too late, before someone's paraplegic, before their pain is out of control and their spine is unstable. The 2005 study demonstrated the clear benefit of intervening surgically in someone with metastatic cancer to decompress and stabilize the spine in the case of someone with neurological deficits versus radiation. They were comparing the two. They actually stopped the study early because the surgery followed by radiation was so superior to patients just getting radiation.
A multidisciplinary approach is key to a successful outcome. With every cancer specialist present, a thorough case review is conducted to discuss the best possible strategy for each individual patient.
Teamwork is absolutely critical to these cases. Treating the spine or treating oncology is very complex. Having a multidisciplinary approach is very important, and having an approach where all the clinicians, including the support services, work together in concert really does derive a better outcome for the patients.
Once in the OR, each surgery can take many hours. With CAT scan and MRI images and occasionally intraoperative spinal navigation to help precisely guide the surgeon, it is again a team effort to ensure a successful outcome. Ellen Eichhorn was a candidate for such a procedure and is thrilled she made the decision to undergo the surgery.
I went from being in a bed in the hospital, bed bound, and now I'm up and I get up in the morning and I take a shower, I get dressed, I get up and I go into the kitchen, I get into the cabinets and the refrigerator, fix myself breakfast.
There was a time when a diagnosis of cancer meant the unthinkable. But advances in cancer treatment are turning the tide on patient outcomes and saving lives.
Right now, everything is working and the tests are coming back positive, and so I'll take it. I'll take every little thing that they give me. I'm thankful for all of this. I mean, this is a great group of people, and it took, every one of them to get me where I am today.
The patients are looking to a multidisciplinary approach. Many healthcare professionals are helping out. So to be able to intervene and change their functional outcome and potentially improve quality of life and even longevity in some cases is extremely rewarding.
As a board-certified, fellowship-trained spine surgeon, Rick Placide has the expertise and passion to handle some of the most challenging spinal pathologies, including tumors. Working closely with cancer specialists at Thomas Johns Cancer Hospital gives him the edge needed to perform these often complex procedures.
I think it is one of the fields where truly miracles happen now. And I believe that some patients who would have just in the old days been told that there can nothing be done, you see them get out of bed, walk, be much better pain controlled or even have no pain at all, preserve function, which was possibly at stake to be lost, and do this with a often very intense procedural attempt, but on the other hand, the outcomes are often more durable.
Unlike many other surgeons, Dr. Placide has the ability to interact with the entire cancer team on a regular basis and performs his surgeries in a setting that allows him to access the complete cancer care network.
The right oncologist and the rest of the team, radiation oncologists, the therapists, the nurses, the entire team have to have the same goal. I would think that everyone would want ideal patient outcomes, but everyone needs to be on the same page. In other words, up to date. What is the latest? What patient can be helped by a particular intervention? What patient can't be helped? And by having everyone on as up to date as the next person, ideally the outcomes would be improved.
Dr. Rick Placide is committed to enhancing patients' lives by promoting awareness about what spine surgery has to offer patients with spine cancer and some of the potentially life-altering procedures.
The mission one is patient care. That's always at the forefront. Offering the latest cutting-edge treatment possible, in this particular case, patients with cancer of the spine, whether it's a primary cancer of the spine or a metastatic spine cancer. Going along with that, other parts of the goals or mission would include education. And I think our effort now is just spread the information, spread the word. Don't see this patient and give up hope. Refer them to the appropriate center and let those that deal with cancer day in and day out make that determination.
He is intrinsically motivated to do the best possible care for his patients. That's why not only myself, but the other clinicians involved, physicians, nurses, social workers, dietitians, love working with him. He gets the big picture, and he's truly trying to provide the best possible care for his patients.
Dr. Placide's experience is a testament to his dedication of improving patient outcomes. Less pain, a better quality of life, increased longevity. These are the driving forces behind Dr. Placide's mission. For more information, log on to richmondspinesurgery.com.